In this episode, we are going to be talking about what to watch for when you start GLP-1 agonist. So you just started your GLP-1 medication and you're nervous. It could be a Wegovy pill or injection, Zepbound, Ozempic, Mounjaro, or Fundeo. And now your stomach is unhappy with you. Let me go through what is normal, what to do about it or manage it at home, and what should send you straight to the emergency room or your doctor. First, let's go over what is normal and expected response. The most common side effects that I've seen in my practice when you first start a medication or increase your dose are nausea, decreased appetite, fullness after very small amounts of food, constipation, fatigue, and occasionally reflux or bloating. These are expected. Some patients can have diarrhea. This is because GLP-1 medications slow down how quickly our stomach empties and how much time our gut needs to adjust to that. These symptoms are typically worst in the first 24 to 36 hours after the medication, and they almost always improve over time as our body adapts. Here is how to manage them at home. Number 1, nausea. Eat smaller amounts more frequently. Do not skip meals because an empty stomach usually makes nausea worse on these medications. Avoid fatty, greasy, fried, or very spicy foods because they are going to stay in your stomach longer and amplify the discomfort. Eat slowly, sit upright. Ginger tea, cold water, small crackers can all help. Eat at least 3 hours before going to bed. Reflux can get significantly worse when you are on these medications. Now, constipation. Increase your fiber and water intake. Consider a fiber supplement like Metamucil or Benefiber. Make sure you're drinking at least 64 ounces of water because the medication can contribute to dehydration, which worsens constipation also. If fiber is not enough, daily Miralax is safe and effective. You can also add stool softeners like Colace if needed. If none of these interventions work, talk to your physician for a prescription medication to manage your constipation. Bottom line, you do not want to be backed up. Next, fatigue. It's almost always from two things: not having enough protein or dehydration. When the appetite is reduced, so is the desire to drink water. So make sure you're getting enough protein and you're getting enough water. The other common thing that we see is injection site reactions, mild redness, itching, or a small bump right at the injection site. It's normal and typically resolves within a day or two. You can use over-the-counter hydrocortisone cream for itching. Rotate your injection sites each week to prevent this from building up in one area. Now, let's talk about when you have to stop managing at home and have to call your physician or go to the emergency room. If your nausea and vomiting is so severe that you cannot keep any food or liquid down for more than 24 hours, if you're showing signs of dehydration like dark colored urine, dizziness when you stand up, extreme weakness, no urination for many hours, if you develop significant abdominal pain, not just nausea but actual pain that is severe or radiating to your back, if your constipation becomes so severe that you have not had a bowel movement in 5 or more days despite doing the fiber, water, Miralax, and stool softeners, please go to the emergency room. Severe abdominal pain that radiates to your back can be a sign of pancreatitis, and a right upper abdominal pain can be a sign of gallstones, so make sure you go to the doctor right away. Signs of serious allergic reaction: swelling of your face, lips, or tongue, difficulty breathing, chest tightness, shortness of breath, or a sudden feeling of doom, call 911 immediately. Severe persisting vomiting when you cannot keep down any liquid for more than a day can also result in acute kidney injury and electrolyte abnormalities that need clinical management and maybe IV fluids. Signs of low blood sugar can also be there if you are a diabetic: shakiness, sweating, feeling faint. And one more thing before we end this is that most commonly the side effects are mild and are manageable. The majority of people have no problem and do not need medical intervention. Only 5 to 10% of people stop the medication because of the serious side effects. And most of the times when you manage the symptoms appropriately, the symptoms settle. Give time to your body to adjust. Drink a lot of water and eat enough protein and fiber. If this was helpful, please let me know. Thank you.